Hi, my name is Mahin, and I'm one of the team working in the Wolverhampton Integrated Musculoskeletal Service. One of the common themes we've noticed in referrals is where conditions fall outside of the scope of our service. Unfortunately, this can also delay the patient journey. We want to ensure patients see the right person at the right time, so today I'd like to explain more about who we are and what we do. We are the Wolverhampton Integrated Musculoskeletal Service, or WIMS for short. We offer a range of services to make the patient journey as seamless as possible, including MSK assessment and treatment, MSK diagnostic referrals, therapeutic joint injections, orthopaedic triage, pain management services, and rheumatology consultations. Within Wolverhampton, we work as a single point of access for non-urgent MSK, chronic pain and rheumatology conditions. Patients who come and see us can expect us to review or offer conservative management to ensure it has been rooted in evidence and suits the patient individually. When this is the case, and if appropriate, depending on condition and patient choice, we can provide workup and investigations for secondary care referrals, or otherwise look to education and self-management strategies to empower patients managing their conditions day to day. By doing this, we are ensuring patients have a say in their treatment, while also optimising pathways. To access the service, individuals must be over 18 and registered with a GP practice in Wolverhampton and presenting with musculoskeletal, chronic pain or rheumatological symptoms. Unfortunately, we are not set up to support urgent or emergency referrals, such as fractures, acute rheumatology pathologies or red flags which have not been investigated for, such as malignancy, infection or Cauda-Equina syndrome, as we do not have access to urgent imaging or referral pathways. If you suspect anything such as this, or any other urgent or emergency concerns, you can still refer directly to the relevant hospital services. If these symptoms become apparent while the patient is within our service, either during triage or while assessing a patient, we may refer them either directly to A&E in emergency cases, or otherwise back to yourselves to investigate these as you deem appropriate. We are always happy to accept re-referral once this is completed. I'm now going to share a bit about each of the different branches of our services, what they offer, and who they see. The MSK team provide assessment and diagnosis based on clinical history and physical examination of musculoskeletal complaints. They are physiotherapists and sports therapists who work with patients to develop a shared plan on how to achieve their goals, using strategies such as education, individual or group rehabilitation, and, where clinically indicated, hands-on therapies. The Clinical Assessment Team, or CATS, deliver MSK assessment by advanced MSK practitioners for people with complex presentations or histories, and also in instances where physiotherapy or other conservative management has not led to an improvement in symptoms. These assessments are completed with a view to finding a way forward for the patient as regards to diagnosis and management options. The rheumatology team includes a consultant rheumatologist and advanced physiotherapy practitioner to assess and diagnose patients where there is a suspicion of an inflammatory pathology or connective tissue disorder, to determine a diagnosis based on clinical history, as well as arranging any relevant investigations such as blood tests or imaging. Finally, the service I work in, pain management. We offer MDT assessment of people with chronic or persistent pain. This is pain that has lasted for longer than a 3-month period. Within our pain service, we offer specialist physiotherapy, psychological support, pain-related medication reviews, and both group-based and one-to-one rehabilitation. Please also note that patients requiring psychological input beyond that offered in our service should still be referred to Healthy Minds or other local mental health services. We also have an 8-week face-to-face pain management program and a 5-week virtual pain management program that aim to help people develop non-pharmacological strategies to manage their pain. So that's our service in less than 10 minutes. We appreciate this doesn't cover every situation and every patient, so as always, if you have any questions or want to discuss any patients with us, please don't hesitate to get in touch and one of our team will get back to you.